we had our first medical mission in 2005. The doctors went and did about 23 to 25 hip and knee replacement surgeries. And it was the first time that number of complex joint replacements had been done in Nigeria over such a short period of time. And then in 2018, my dear friend Kevin El-Hayek did our first minimally invasive surgery mission. And we went back to doing ortho missions in 2019. Obviously 2020, the world stopped and we didn't do any missions, but then Kevin returned in 2021 and here we are in 2022.
We have now done 3 missions really centered on laparoscopic or minimally invasive surgery and offering these to the poor and vulnerable in Africa. We'll check on her again, but she can drink and ambulate.
It's been a very interesting outing. The patient has benefited.
I've been having this hernia case since childbirth, but with the help of Jinko free surgery, I'm free. Like, they did surgery yesterday and I'm well now, and I no longer have the pain I used to have before.
A lot of them who were actually scared of having an open surgery have actually benefited from the laparoscopic repair of their hernias, and the fear of staying away from work or staying away from activities for a long time has been mitigated by this. So within a few days after the surgery, they were discharged and they are going back to their duty.
Patient knows he has a hernia, has a deficit in the abdominal wall, and after an hour, 30 minutes, patient comes out, wakes up from anesthesia, and there is no more hole in their stomach, and they see a couple plasters, and they're like, what happened here? And that has been the expression all through.
We have activity all over the hospital. We have Dr. Kevin El-Hayek here in the main conference room with some of the trainees who have come from all over Nigeria, and they are watching a surgery that Dr. Bipan is doing up in the OR. We also have some of those doctors actually in the OR with Dr. Bipan helping out and assisting on that surgery. And then we have Dr. Veronica Sullins in a separate OR doing her own surgery with her own set of residents and doctors who are local assisting her as well. And then we have Cherese, who's another member of our team, who is helping just get the ORs, keeping them going with supplies and instruments and making sure everything is laid out well.
I've been one of the nurses that has went between the families and the patient during surgery. So keeping the patients updated, keeping the families updated.
So we're gonna take the dressing now.
We were able to provide care in 2 separate operating rooms pretty much continuously for 5 days. So the number of patients we took care of and the number of procedures that we did probably doubled or maybe even tripled from previous missions.
So the surgeries that we did yesterday were 3, 2 boys with hernias in both the umbilicus and the inguinal region and large hydroceles. Hopefully that they're impacted in a very positive way, especially the young girl who has abdominal pain. We were at least able to see and tell her that her ovaries looked normal. The 2 little boys, I know that they were both having pain and discomfort when they had swelling down there, and I think that this will help, especially after they recover from surgery. A couple of them want to go back to track running and football playing, and so I think they should be able to do that in the next couple of weeks.
We thank you very much for your kindness and your big hearts. You people have tried a lot.
So we started from just what the community has. So we have obviously a lot of hernias here, something that I do a lot of, but much more common here in Africa.
Why we do have them is because of late diagnosis and poverty. People cannot afford. These surgeries that was done actually were paid for by the Jenko Foundation.
And I just think about those patients and that all of the challenges, all the difficulties that stand between us and the patient are worth getting through so that we can connect with that patient and change his or her life.
I was diagnosed with PCOS 3 years ago. And I want to thank Jenko for the opportunity. I went for surgery yesterday and I'm feeling better now.
Apart from the outreach to treat people, what impacts more to us actually is this training aspect. which is empowering the local doctors here to also have the capacity to take care of these medical challenges in our environment. That's because that will go a long way to addressing the health needs of Nigeria.
They're really passionate about it, and they want to bring it to their area of Nigeria and into their practice. And they just love the hands-on training and the learning and being in the OR with these really experienced doctors that have come from the US to really to serve them and empower them.
So I see all of these surgeons here in 2 to 5 years being the leaders in laparoscopic surgery wherever they are. And I see them being little points of contact of minimally invasive surgery, and then I see it spreading from there, almost like a virus. And then it's going to infect the country in a way that will allow patients to get excellent surgery.
It's just increased my passion for the field of minimal access surgery, and we want to believe that this part of the world, one of our major problems is expertise and manpower, which I think this program is going to address. Though a little bit, but it's the right direction, and that will help us from this part of the world. Thank you very much. Great thanks to Jenko and his facilitators. Thank you.
Thank you for allowing us to do this work, and Dr. Lang will be here again.